Hello, everybody. I'm really excited to hop on a live today with one of my absolute favorite people on the planet. I'm going to jump on. We're going to actually here for you CPR. If you follow me for a while, you've probably seen me with pop-up classes. There he is! Technology works today. I love when it works.
Hi. Yes, it worked great, which is shocking. I was nervous about it.
I know, right? So I hadn't even gotten through your introduction yet because you were too quick on that jump, hopping on. So I was just going to introduce you that you and I have actually taught several classes together, local classes, but I'm going to let you introduce yourself, who you are and what you do.
Sure. Thanks, Julie. Thanks for having us on. So I'm Alan from Here for You CPR. Everyone, welcome to the live. Today we're talking all things CPR, choking, safe feeding, any topics you want to bring up. Now's the time because you have two really experienced people here that can answer your questions. Both Julie and I have taught together and do collaboration classes. We actually have one coming up, which is a nice little present for you guys if you wanted to take an in-person class. There's one coming up July 13th in Redondo Beach, and Julie will tell you more about that later on at the end of this live session. But yeah, I'm Alan again, and my wife and I started this company when we were pregnant with our son, who's now 2.5.
Is he
And
really two and a
I
half?
know, yes, you were our lactation consultant, and now he's 2.5. So I can't believe it. He's growing so quick. But yeah, we started this because we wanted a way to be able to help parents and empower you guys in answering all the scary questions. A lot of people have questions around feeding, when to start solids, and what happens if they choke. So today we're going to talk all about that. Back to you, Julie.
Now I obviously am seeing babies starting at birth, and then the conversation comes in when we're hitting like 4 5 6 months of we're going to start solid foods, and that can be really scary for a lot of parents. So that's usually when I'm like, hey, you need to go see Alan. When do you typically recommend that parents take that CPR class, and what kinds of things do you cover in your classes?
Yeah, it really depends on how comfortable you are. We do have a clientele basis where they're pregnant, expecting, right? And so I think that's a really good time as well because you're like, okay, baby's coming. We should kind of prepare the nursery, put the bassinet together, get all this stuff going, sanitize the bottles, maybe take a CPR class as one of those checkoff lists as well. I personally would take it back then and then also do a refresher. Now, the unique thing about CPR in pediatrics is when they're 0 to 12 months, the techniques are different than when they hit 1 year of age or kind of freely standing, which is around that 12 months of age. So then the technique completely changes. And what a lot of my clients have done is they'll come back to me and they'll take a virtual just like this. They'll take a virtual refresher. Hey, can you refresh us on how the technique changes? 30 minutes, 40 minutes. I'm here to answer your questions. We do a quick refresher. It's right back in your brain again, and now they're one, and you know what to do in case something happens. But really, at any age, and no judgment, right? Like if you haven't taken it yet, no problem. Do it now. It's not too late. I think it's also super crucial. What we specialize in is grandparents. Grandparents haven't taken a CPR class in many years, and CPR and how we do it for pediatrics has changed in the past like 6 years. So I would say if grandparents or caregivers are involved, older family members, bring them in. Let's have a CPR party. Our model is just like Tupperware parties back in the day. We come to you, we come inside your living room, we set up with your friends and family and your loved ones who will be around your children. And we teach you guys how to save lives because you are your children's first responders.
Mhm. Yeah, and it really is. I was just reflecting when you were saying that when I worked at the hospital, I had CPR training every quarter.
Mm-hmm.
As in every 3 months, we had to do a module as a refresher. Now, I was a speech therapist. If I had a patient code or was having issues and needed CPR, I was the first person to be like, nurse,
Yeah,
doctor, push the button, right? I never
yeah.
actually did CPR on a patient there, but I was still required to know. And in that setting, we were refreshed all the time. And I can even tell you as a healthcare professional, you forget if you don't use a skill, or are refreshing yourself on it, you will lose it. So it really is important. It's why healthcare providers are required to take it usually every year or every other year, depending on
Mhm.
their setting and their profession. But yeah, if you haven't taken one and you have a baby, it's really important to at least have that as a skill.
Yeah, some of the things that are additional, just thinking about CPR, the actual act of cardiopulmonary resuscitation in pumping a heart from the outside is less likely to be needed. The more important stuff are things like learning about drowning prevention and how to mitigate that risk and lower it. And then poison control is something we cover, right? Furthermore, we cover all things choking. We talk about the LifeVac device or any sort of de-choking devices, which we can answer questions on today. So our class goes a little more in depth. I would call it more of like a safety course for parents, really, because we also cover first aid and home baby proofing. It goes a little more further than you would think with just CPR. So I think it's a really unique, nice, catered, pediatric focused class for your new babies or
Well,
existing.
and I mean, even last time we taught it, I popped out and we had an entire conversation on sleep and sleep
Mhm.
positions and safety of sleep, because sleep is often when we have our highest risk of sudden infant death from breathing and respiratory compromise. So there is this combination of knowing how to do CPR when your child isn't breathing and how that relates to safe sleep, right? Which is a whole other topic in and of itself. And it was really fun in that class to be able to actually hone in and discuss the recommendations by the American Academy of Pediatrics versus the recommendations of the Academy of Breastfeeding Medicine, differences between co-sleeping and back to sleep, and how they relate to, because that's the highest likelihood. If your baby's not breathing, you're going to start CPR. And when is that highest likelihood? Potentially when they're sleeping.
Absolutely. Absolutely. And SIDS case is really prominent in the US and have gone up recently. But if you look at outside of the US, you don't really see too many SIDS cases. So it's really interesting, and they can't really point how it's happening or what it's caused from. But things like that to empower you just to know how to act, right? So sometimes we freak out as first time parents, guilty. I've done it many times where I'm like, is he breathing? And you don't know. You're like checking and trying to listen. But at the same time, these are things that, if you know how to respond or know what tools to pull from, I think it's super crucial to have. Because this leads me to my next thing is, and I don't know if I'm going off agenda or
Yeah,
not,
that's
but
fine.
just a question for everyone. There's several people on the live. How long do you think it takes when you pick up the phone and call 911 for them to arrive at your house? And so this is always a question, not to scare anyone, just to really put it into perspective. Of course they're going to come, right? Emergency medical services are offered everywhere and available everywhere. We really have a good system in our counties. Some counties take a little longer than others, and some have trouble with staffing as well. So I would say that's something to keep in mind. But calling 911 and waiting, the average response, and I'm talking about LA City, so this doesn't apply everywhere, is 7 to 14 minutes for them to come to your front door. That's a long time if a child has something stuck in their airway, or what we call airway asphyxiation, which is complete blockage. That's a very long time. If you didn't know what to do or how to get it out, you're waiting for them to come. And so I think that's super crucial to put into perspective. Again, not to scare anyone.
That's really scary. That is really scary, though,
Yeah.
to think about when you hit that line of a noxic brain injury, meaning the brain hasn't had enough oxygen. Do you have any statistics on that? Of can you talk a little bit about that?
Yeah. So airway asphyxiation, so no oxygen going down into the lungs. Baby can't breathe, AKA known as choking. And by the way, choking is completely silent. You can't hear it. So that is why we have to pay attention, especially during feeding or playtime. No feeding in the car seat. This is one of those things that you hear, but we passively do it. So no goldfish snackies, please. These are things that we want to focus our attention on the children, because you cannot hear choking. It's silent. So if there was an airway asphyxiation, going back to what Julie's talking about, at about the 4 minute mark of no air going into the lungs, we're going to start seeing parts of the brain getting damaged. And that's super crucial. because sometimes those things can't be fixed. At the 6 to 8 minute mark, you're talking about almost irreversible brain damage in anyone, not just a child, even an adult. So 6 to 8 minutes. And going back to my statistics about how long it takes for 911 to arrive, 7 to 14 minutes. So if I knew nothing else other than picking up my phone and frantically dialing 911, I'm going to leave it there. So this is super crucial for you to know kind of how to act and try and get an item out so that they can breathe again, because that's your number one goal in that emergency is get it out.
Yeah, for sure. Do you have any quick tips and strategies for us, or do you want to save that as a teaser for the class?
I brought my show and tell mannequin, and I just wanted to be able to show people if that's okay with
Yeah,
you.
let's do it.
Yeah.
Absolutely. Bring it
All
out. I
right.
love that.
Okay, here is little Jimmy. He is my 0 to 12 months mannequin, which you get to practice on this when you come to one of our CPR courses or any CPR course. If you're doing it in person, you're definitely going to get to practice on the mannequin, which I think is key, honestly, to I learn holding and doing hands-on. Watching a virtual is kind of difficult because you don't really have anything in your hand, so it's going to be hard to follow along. But if I had an airway asphyxiation, now let's talk about, before we even get there, let's talk about the differences between gagging and choking, which is the number one question that I get all the time from parents is, she's making all kinds of weird noises. We just started solids. We want to do baby-led weaning or pureed foods or whatever you choose to do. It doesn't matter. Here's what I want you to think of. They've had milk, breast milk, formula, for like 6 months, liquid. Okay, they're used to it. They're used to kind of feeding in this like side lying kind of position or with a bottle up here. And then all of a sudden you stick them in a high chair and you give them mushed avocado or hot banana cereal or whatever it may be. You hand them a turkey leg, right? Whatever you're going to do. It's all different tastes, textures, weird hot mushiness they've never had. They're gonna make faces and noises right from the beginning, okay? In fact, I think you can probably confirm this for me. Let's take banana for an example. You may have to try banana like 12 times before the child decides if they like it, right?
Yeah.
So these are the things that we have to keep in mind. They're definitely going to make weird faces. They're going to gag. They're going to spit it out. They're going to do a sour face, tongue out, right? Um, all of that is okay as long as we remember the basics. Gagging, crying, screaming, yelling, throwing avocado in your face, having a full-on tantrum, spitting up, throwing up, taking it out of their mouth, and as long as I could hear something happening, I am please rest assured that they are not choking. You have to do a little bit of adult unlearning because immediately as first-time parents or even second-time parents, we completely go into panic mode. We're like, oh my gosh, what's happening, right? We have to remember that if there's any sort of airway exchange, they're not choking. And also another key point that we also point out, and I think Julie can confirm this as well, is intervening at the wrong time might be a bigger issue because you may cause the child to choke. Let me explain. You have a child, they are born with the natural ability to be able to clear their throat. Gagging reflex, coughing it out, this is all normal stuff we don't need to teach them. So if they have something that they're trying to actively gag or get out, we want to let them do that. You want to let them be. Because if I pick up this child, I don't know if you've ever seen this, you pick up a child when they're coughing or actively gagging and you go, oh no, right? This is super dangerous because what you can in fact do is as I'm doing this to try and help, I'm actually shooting the item back and down further, maybe causing the child to choke when they weren't choking in the first place. So you want to be really careful about intervening at the wrong time. So again, always just think about airway. If you hear any sort of noise exchange, they're not choking.
Let them be.
Let them be. And by the way, Julie and I and all of you on the live, if you drink water and it goes down the wrong pipe, you're going to start Coughing.
Cough.
Yeah, violently. So you're like, right? I turn into an old man when that happens to me. And I turn all red. Same thing with them. They're going to cough it out actively because the blood is rushing up to their head so they can actively get it out. Best thing you can do is kind of encourage them to spit it out into your hand. You make an exaggerated movement of your mouth and noise like ah, and as you do that, they're going to learn and mimic so that every time they feel something's too big, they're going to do that. Just open their mouth, tongue out, it'll come out. My son's 2.5. He learned it early on because we did that a lot. And to this day, now he's learned. He walks over to the kitchen. If it's too big, he steps on the trash can opener and it opens up and he spits it out into the trash can because he's learned on his own. Too big. I bit off too much. I can't chew it. Let me get it out.
Yeah.
So super crucial to teach those kinds of things. So again, not intervening, letting them be. Now, as parents, Mama Bear and Papa Bear is going to come out, and if you see something too big, like half of a steak is hanging out, yeah, by all means, pull it out if you can actually see it. If you cannot see it, the other key thing is please don't stick your finger in blindly digging for gold. This is where we also cause an issue because same idea, if I stick in to look for something, I could push it down further and maybe lodge it when it wasn't in the first place. So be careful of that. Now the alternative. So the alternative is a scary one where we do need to jump into action. The child no longer is making any sort of noise. So noise is gone. That means choking. Can't hear it. They're making an ugly face, which looks like this. Silent, eyes squinting, mouth open, tongue out, struggling. Meaning it's not coming out and it's not going down. So we need to be very careful of that because there's something wrong. At this point, you do need to intervene. Okay? And the other scary thing is if there is no air going in and out, right around the lips, almost immediately starts changing color. You all know your children's colors. It doesn't look right. It's not the right color. It's like a dark bluish, purplish, sometimes really dark red. Not good. At that point, you need to jump into action for sure. I'll pause there before I show the technique. Do you have anything to add on as a speech therapist?
No, I don't think at that point. We actually are coming out of our time that we have together. So what I think I want to do is hold all of that goodness and give it as a teaser for that class that we have coming up. Okay. So you'll start to see in the next week or two, I'll start posting on how you can sign up for that course. Because now that you've got a taste of it, don't you want to come to class and come listen and learn
I
all
do.
of the
I'll
strategies,
be there.
techniques? I do. I'm like, oh my gosh, I forgot how fascinating this is because I tend to pop in and out of the class when I'm with you. So I'm like, oh yeah, I should sit in through the whole class again this next time coming up. But I think these are all fabulous techniques and strategies. I do really believe every parent needs to know how to do these strategies. Every grandparent should know how to do these strategies. So if you are here in Los Angeles and want to come out, we're having that in Redondo Beach, and you'll start to see some more information on that coming up soon. Okay. Alan, thank you so much for coming on the live with me today.
Got it.
Let's do another one of these soon, and we'll keep just giving people little tidbits so that they keep wanting to come back and learn more about this very important topic.
I love it, Julie. Thank you so much for your time. Folks, if you have any questions, reach out to Julie or myself on our Instagrams, and we'll be able to help you and hope to see you in class.
Amazing. Thank you so much. We'll talk to you again soon.
Yeah. Bye.